Hi, I'm Dr. Umang Kothari, plastic surgeon and director co-founder of the Head and Shape Clinic, Mumbai.
Hi, so today we have this case of grade 2 gynecomastia. We have just started the case and we are infiltrating with the fluid which is going to dissolve or emulsify the fat, and then we are going to start the suction and then the gland removal. So that is the liposuction procedure in which the hollow cannula goes inside the body, and with movement you will see that pipe is getting filled with a fatty material. That's a day 6 of gynecomastia surgery. We have just opened up the dressing. There's a little bit oozing from this side. We are going to put a small dressing over here, and that's it. Can you just give me 90 degree? And that's the flatness we can achieve by doing liposuction and the gland removal.